afternoon. I'm Erica Sargent. Governor J.B. Pritzker holding a daily COVID briefing from his home today after a member of his staff tests positive for COVID-19. Let's listen in.
First, I want to address why this live stream looks so different today. One member of my senior staff who was not exhibiting any symptoms has tested positive for COVID-19. And for that reason, in accordance with the best public health practices and protocols and recommendations of doctors, the rest of our team, myself included, is working from home for the time being. And I want to assure everyone that the governor's office is very much still in full operation, and all aspects of the executive branch will function as they have been. And with that, I'd like to turn it over to Dr. Ezike for today's medical update. Doctor.
Thank you, Governor. Good afternoon, and thank you for joining us on this new web-based platform. Let me start with a bit of exciting good news. We did receive our first allocation of remdesivir, the investigational antiviral drug. The National Institutes of Allergy and Infectious Disease recently conducted a clinical trial and found that patients who received remdesivir had a statistically significant shorter time to recovery compared to those receiving a placebo. The Department of Health and Human Services sent an initial shipment of remdesivir for the treatment of hospitalized COVID-19 patients. We received 140 cases of the medication this last Saturday, and the cases have been shipped to 14 hospitals around the state. Each case contains approximately enough vials to treat 5 or so patients, depending if the 5-day or the 10-day protocol is employed. Since it was going to be impossible for every hospital to get a case, we did establish a criteria, including hospitalization and intensive care unit data, and also trying to make sure that we had an equitable, transparent, data-driven way to allocate the medicine. It was distributed to hospitals that have seen the most critically ill COVID-19 patients. We also included safety net hospitals and hospitals treating large communities of color to address the equity aspect. We do expect to receive more remdesivir in the future, but our hope is that the allocation that we received on Saturday can already help to improve outcomes for some patients who need it most. Over the past 24 hours, I do need to report that 54 additional deaths were reported to bring our total COVID-19 death toll to 3,459. In the last 24 hours, 1,266 new cases have been reported for a total of 79,007 cases here in Illinois. We have been tracking cases at the Illinois Veterans Homes, including 40 current cases at the Manteno Veterans Home, 30 residents and 10 staff after testing of the entire facility, and 1 resident at the LaSalle County Veterans Home. Testing has already occurred at the LaSalle home, is currently taking place at Anna, and will occur on Tuesday at Quincy Veterans Home. Neither Anna nor Quincy are reporting cases at this time. The Illinois Department of Veterans Affairs is following guidance from state and local health officials, which includes continuing health screenings of staff and residents, maintaining social distancing practices, wearing face masks, using gloves, gowns when indicated, and intensified cleaning and disinfection protocols. As for hospitalizations across the state, 4,319 people in Illinois were reported to be hospitalized with COVID-19. And of those, 1,248 patients were in the ICU and 730 patients were on ventilators. To date, 442,425 tests have been performed, of which 12,441 were reported in the last 24 hours. We must continue to do all of the things that we've said here hundreds of times. Stay home as much as possible, wear a face covering, keep 6 feet of distance between you and others, and wash your hands frequently. these are the steps that will continue to help us stay healthy and get onto the other side of this pandemic. Thank you.